tibial nerve, anatomy, pain, and block. Let's get started with anatomy. So the tibial nerve originates from L4, L5, S1 to S3. It's a major branch of the sciatic nerve um, that descend in the posterior compartment from the popliteal fossa. The tibial nerve passes under the tendinous arch formed between the fibular and tibial head of the soleus muscle, this muscle right here, and it passes vertically through the deep region of the posterior compartment of the leg on the surface of the tibialis posterior muscle within the posterior with the posterior tibial vessel. So the nerve then leave the posterior compartment at the ankle by passing through the tarsal tunnel. So it's very much straight until here it takes the turn and pass through the tarsal tunnel to supply the ankle, the foot, and in the leg, the tibial nerve give rise to branches that supply all the muscle in the posterior compartment of the leg and give two cutaneous branches, the sural nerve and the medial calcaneal nerve. So if we look here, this is the medial sural cutaneous nerve, so don't get confused. This is superficial nerve. I removed it. Here you have the lateral head of gastrocnemius. I remove it. Then the medial head. I remove it. Then you have the plantaris muscle. I also remove it. Then you see the soleus muscle with the two heads, fibular and tibia. So if you remove that, then you see the tibial nerve with the posterior tibial artery and vein running together as an important landmark above the tibialis posterior, which I highlighted, which is a muscle between the tibia and fibula. So remember this orientation. Now, and remember that the tibial nerve run with the posterior tibial artery and vein all the way from the just below the popliteal fossa to the tarsal tunnel. Would that remind you with which nerve run with the anterior tibial vessel in the anterior compartment? The answer in my previous video. So if you look here, so from the knee level, it start to bifurcate, and here we're not zooming in the common peroneal, we're zooming in the tibial. As you see, it gives you the medial branch of the sural nerve that eventually will join the communicating nerve and which is come from the lateral branch. We'll cover that in the next lecture. And then here you have a bunch of muscular branches. Here it's branches for the skin and the joint of the ankle. And then here at the tarsal tunnel level, it starts to bifurcate, which we'll go over that in a minute. So here, again at the tarsal level, it divides into three branches. The medial calcaneal branch, which goes here, the lateral plantar nerve, and the medial plantar nerve. And it supply all of them, they have sensory and motor innervation to different areas, which I will cover in a second. We don't need to know all these details, but it's here helpful. So here, this is just looking from below. So this is the medial calcaneal branch, as you see. And then here you have the medial plantar nerve and the lateral plantar. So if you look at the sole or the plantar aspect of the foot, very much all supplied by the tibial nerve, except a very small area here by the saphenous and very small area here by the sural. So here, the all branches of the tibial nerve or the posterior tibial, but here you can see this is more belong to the medial plantar, and this is to the lateral plantar. And we see how they bifurcate at the tarsal level. So if we look at the tarsal tunnel here, which is underneath the flexor retina column here. So you see in the tarsal tunnel, starting from anterior to posterior. So you have the tibialis posterior tendon. Behind that, the flexor digitorum longus tendon. Then behind that, you have the posterior tibial artery and vein. And behind that, you have the posterior tibial or the tibial nerve. And just posterior to that, the flexor hallucis longus. So if you are feeling the pulse of the posterior tibial nerve, posterior tibial artery, the nerve is just posterior to that within the tarsal tunnel. And that's another zoom in here to see the orientation of them. So how the tibial nerve pain presents? So the tibial nerve, again, it innervates the muscle of the posterior leg and the three important muscles here, the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. And we looked at the sensory innervation. So when you have a pain related to the tibial nerve, mostly it's in the entire sole of the foot, unless if you have a specific branch injured. And typically this pain increase with weight bearing. So causes of injury starting from above, we have the soleal sling syndrome, which is a proximal tibial nerve compression. Then you have the tarsal tunnel entrapment, which is probably the most common cause. You have any ankle injury or surgery, compression along the course of the nerve due to tumor or cyst, and blind posterior tibial vessel cannulation. So when you examine for entrapment, or so basically you feel the medial malleolus here, and just behind it you will feel you will walk over the tibial nerve, palpate on that level, and you palpate over also the branches. Now, what's soleal sling syndrome? So the soleal sling is a fibrous sling between the tibia and fibula, which is the origin of the soleus muscle and the location of the proximal compression of the tibial nerve. So that's basically the sling. That's the fibula, that's the tibia, and as I showed you, the nerve run underneath that. So basically, this is a normal looking nerve, and this is more squeezed, compressed nerve. So how this present? Pain on the distribution of the tibial nerve. You can have tenderness with palpation of the posterior calf, where the soleal sling is. So it's about 5 to 9 centimeter below the popliteal crease. You can have some numbness, dysesthesia on the plantar surface of the foot, skin hypersensitivity. You can have feeling of tightness in the calf of the muscle. You may have a positive tunnel sign elicited with percussion at the site of the entrapment. You might have also weakness of the flexor hallucis longus muscle, which is one of the muscles innervated by the tibial nerve. So differential diagnosis, think about posterior compartment syndrome, and here popliteal artery entrapment syndrome. Of course, you can do different workup technique, nerve conduction study or AMG. It can be non-conclusive because the nerve is usually deep at this level, and it might be hard to elucidate that. So it's mainly a clinical diagnosis. Now, since we are talking about peripheral nerve stimulators, the tibial nerve actually is a very common target for other non-pain condition. Mainly, specifically, we are talking about here urology diseases. So interestingly, the FDA approved the following indication for posterior tibial nerve stimulator: hyperactive bladder and associated symptoms of urinary frequency, urinary urgency, and urgent incontinence. And the idea that when you stimulate the tibial nerve, that that give you a retrograde stimulation of the lumbosacral nerve, and that eventually how it get control the detrusor muscles and the pelvic of the floor. So it's one of the indications the hyperactive bladder. So how we do the block? So if we start all the way above at the popliteal fossa, and we scan down to see the both condyle of the tibia, and you see the nerve deep running with the posterior um, with the popliteal vessels, and it is usually medial, right? You can go down here about mid leg. So remember the soleus muscle, and you will see the tibia anterior, the fibula posterior. This is the muscle, the tibialis posterior. And again, look for the posterior tibial artery, and usually the nerve is running close to it. So you can block it at this level as well, based again on the symptoms. And of course, if you're treating a solar sling syndrome, you have to go above that. You have to go just where the solar sling, and you can do hydrodissection with the injector at that level. Um, Here, just above the tarsal tunnel, you still can appreciate the posterior tibial artery running with the nerve, and here you start to see the flexor digitorum and the flexor hallucis longus tendons. So you can block it here, or even you can place the stimulator here, whether you are treating pain on the sole of the foot or for urology indication, or you can go even lower at the tarsal tunnel level, and again you will see the artery very clear. You see the nerve next to it, the flexor hallucis longus here, the flexor digitorum longus here. So you can also do it at this level. And that's what I have for you, and I hope you enjoy it. Thank you for watching.